All right, guys, I think we have given about a minute extra time, so we'll go ahead and jump in. So, again, thank you for logging in here and spending your afternoon with us for the next 45 minutes or so to discuss biologics and stem cell therapy, particularly some of the things that we're doing here in the Cayman Islands at Regenexx Cayman. So, I'm Dr. Williams, and I will be chatting with you guys here for the next 45 minutes or so. All right, guys, so here's kind of an overview of what we're going to be discussing at a bird's eye view level. So let's just jump right in. So when we talk about biologic therapy, that includes things like PRP, stem cell therapy, cultured stem cells, non-cultured stem cells, and a couple other things sprinkled in through there like A2M, adipose, etc. So many people are looking and seeking out these treatments for multiple reasons. So some of the issues that you or your family, your friends, or your loved ones may be dealing with may be chronic pain, chronic fatigue, issues with function or quality of life, like issues limiting movements, sports related activity, pickleball, which is a big one these days, or simply getting up from a couch or going up and down the stairs, things that really define our quality of life and our functional capabilities as we get older may become more limited, or if we succumb to certain injuries, may be functionally limited as well. So if this sounds familiar, then you're in the right place, and we definitely have some things to discuss to see how these treatments may be game changing or life changing for you to help improve your quality of life to keep you active. So, what's Regenexx? So, Regenexx is a company that we have been working with here since the past 20 years. Regenexx started doing stem cell therapy treatments in the United States in 2006. Did the first stem cell treatment in the world at that point in time for knee arthritis in 2006, and the first intradiscal treatment shortly thereafter in about 2007. And we came to do clinics in our offshore location in the Cayman Islands in 2011 and been doing this treatment since then. We are very foundation in terms of we believe in research as the foundational principles for stem cell therapy and biologic treatments to make sure it's as transparent as possible so we know what does work, what doesn't work, and how to make these treatments better. So we've published about 44% of research on stem cell therapy for orthopedic conditions to date. There are over 100 clinics throughout the United States and worldwide. We have clinics in the Cayman Islands, I mentioned, in India, in the UK, and Belgium as well, and some clinics opening up in Dubai and China. So, definitely a broad spectrum of providers. And what we focus on here in the Cayman Islands, which is a little bit different, we're the only site in the world with the Regenexx umbrella that actually does culture expanded stem cell therapy. And we'll get into actually what that is and what that entails here shortly. So, who are some of the providers that work down at our Cayman Islands site doing culture expanded stem cells? Myself, I'm the medical director here. I am board certified and trained in the United States. I did all of my medical training at Emory University in Atlanta, Georgia. I am a Air Force veteran as well. I have a practice in Atlanta and published a lot of research, written textbooks on the field and on exercise science as well. Also, we have 6 other physicians that rotate through the various different time points of the year that are extremely highly qualified and talented as well, all board certified US trained physicians also coming from sites from our Colorado affiliates, also from Maryland near DC, also in California as well. So, our treatments that we'll dive into now are really focusing on orthopedics. We don't, at this point, really focus in on any other treatments. So, some of the other clinics out there in the space may be doing things for erectile dysfunction or hair loss, etc. But our goal is to really function in the space of orthopedic medicine. So, what can be treated? The spectrum is pretty broad, but as I mentioned, we really focus in on orthopedic treatments for multiple different types of conditions and ailments as well. That includes things. I think I saw a hand pop up. What we'll do is we'll have a Q&A session at the end of the group session here, guys. So we'll be able to get through all of your questions as they come in, and we'll be able to tackle those. But if there are any auditory or visual issues or media issues, please let me know at any point in time. But like I was saying, we can treat all or things orthopedic, and that umbrella includes things involving the joints and the bones, such as osteoarthritis, gout, cartilage defects and cartilage injuries, meniscus tears, labral tears, soft tissue injuries for the shoulder, including rotator cuff tears, We have issues of the hand and wrist, including carpal tunnel syndrome, arthritis, tennis elbow, golfer's elbow, which is tendonitis or tendinosis of the elbow from overuse. And also, we treat hip issues, particularly with hip arthritis, hip labral degeneration, hip gluteal tendinosis, labral tears, etc. And the spine is one of the common things that we treat as well, which really separates us apart from some of our competitors that really don't do or dive into high level spine care. So we treat things such as disc herniations, disc tears, arthritis in the spine, degeneration, as well as pinched nerves and radiculopathy or sciatica symptoms as well. And we'll talk about kind of the spectrum of how you manage these things with things like PRP versus stem cell therapy. So PRP, which we talked about, the umbrella of biologic therapy, includes things like PRP, but PRP is just platelet-rich plasma. And the basic foundation of this is where we take some blood from a vein in the arm. And as you guys know, blood contains a couple of things, particularly it contains red blood cells, white blood cells, plasma, and platelets. And platelets are one of the initial healing cells in the body. They're like a first responder when we have an injury, right? So the best example I always tell to my patients is that if I was running down the street, I fell down, I scraped my knee up, the first thing that happens is I'll bleed, and then I'll get a scab that forms. And that scab is roughly 100% platelets, and over time in that scab, as the tissue is starting to heal for the injury, we get production of about 2,000 different growth factors from the platelets in that scab that promote tissue healing and regeneration as well. So, when that scab typically comes off and 2 to 3 weeks later, the tissue underneath is healed, right? So that's just how the healing process occurs. The problem is in our orthopedic or musculoskeletal system, we have very poor blood flow to the tissues, whether that be to the cartilage, which has no blood flow, to the meniscus, to the labrum, to tendons and ligaments as well. So when we injure or damage these areas, they turn into chronic degenerative problems, which is what we're trying to do to help navigate that is by taking the platelets from the blood, concentrating them to very high numbers, and then precisely injecting them where you have damaged tissue at. PRP is not created equal. So when you're thinking about PRP at your mom and pop shop down the street or another clinic that may be more local, you want to figure out what the makeup or the biology of the PRP actually is, right? I always tell people that, when you say you're going to get PRP for something, it's a very broad and non-specific term. It's like if I said, oh, I have a cold or I have a fever, better example, I have a fever, I'm going to take a Tylenol. Well, what's the dose and strength of the Tylenol? Because that matters if it's going to be effective, right? If I take an infant's dose of Tylenol or Motrin for myself, if I have a fever, it's not going to work, right? And I have to take the appropriate dose. And we see the same thing with PRP and platelet-based treatments. When we have research studies that show that PRP is not effective for a condition such as Achilles tendinopathy or knee arthritis, when you look at the dosing, it's a very poor quality PRP that is a very low dose. So you need to have the appropriate amount of platelets to get the appropriate clinical response and benefit. And that's what Regenexx really specifies in and allows us to be able to concentrate the platelets to that level of specificity that's to treat a specific condition. It's not a one-size-fits-all treatment. When you have knee arthritis or a rotator cuff tendon tear, we may be using 8 to 10 times concentrated or up to 20 times concentrated, depending on how old you are and what's the severity of the condition we're treating. So PRP works great, better for mild conditions such as mild knee arthritis, small or partial tearing of ligaments or tendons, but the dosing is very critical and important. All right. The Regenexx same-day procedure is what we've kind of classified as a non-cultured stem cell procedure. And 9 times out of 10, that's going to be a bone marrow procedure, and sometimes on occasion it can be adipose or fat tissue. And what that is meaning that the bone marrow contains a soup it's like a minestrone or a vegetable soup. It contains a lot of different things, such as, again, like blood, red blood cells, white blood cells, plasma, platelets, but also stem cells. It contains a couple of different types of stem cells, including hematopoietic stem cells, mesenchymal stem cells, and Muse stem cells. And these all together, we then concentrate them and can inject them to get a healing response to occur. I always tell people the difference between a platelet and a stem cell is like if the platelet was the first responder, a stem cell is like a general contractor. So on a construction site, the general contractor is there, keeping tabs on everybody, telling the different subcontractors what to do. But the contractor can generally do all the work themselves. And that's kind of like a stem cell, because the stem cell is very unique in that it has the highest healing potential and that it can turn into a new cell itself, which makes it very different than the platelet, which cannot do that. So a stem cell can actually turn into new tissue, which is something that's very unique as well. So that kind of gives us the difference between the two. So when we're doing same-day stem cell procedures, that just means it's a non-cultured stem cell procedure, which is great for treating things such as arthritis, larger or more advanced tendon tears or soft tissue or ligament tears. But when we have multiple different joints and larger areas to treat, or if the patient may be a little bit older, because as we do get older, our stem cell quantities decrease, culturing of stem cells may be an appropriate option for you. So that gives us Regenexx C. The C meaning for cultured. And what that means is that we are talking about a cultured expanded stem cell procedure. Culturing just means when we take the bone marrow, as I mentioned, it's like a soup, and it contains all of these different types of cellular products. We actually, in the laboratory, pull out the mesenchymal stem cell from that, and in a petri dish, your own stem cell, grow it to millions of cells with that. And then with that, we're able to then treat multiple areas where we have the limitation of the non-cultured stem cells is there's a finite number. Typically, that number is roughly about 100,000 stem cells when we're treating a different area. When we're treating somebody with culture expanded stem cells, we may be typically using 20 to 50 million stem cells. So there's usually about 1,000-fold increase in the amount of actual sheer number of stem cells that we're using to treat a different problem, whether that be for knee arthritis, tendon tears. And with that being said, because we have several million more cells, we usually can treat multiple different areas, whether that be two knees, two shoulders, a hip, a lower back, or a cervical spine for patients that have multiple areas, which we don't have that luxury when we're doing the non-cultured stem cell or the same-day stem cell procedure. You really can only treat one area at a time because the numbers are finite and much smaller as well. You don't want to get into a situation where you're robbing Peter to pay Paul, trying to treat 4 or 5 different areas where you're getting very, very minimal amounts of stem cells in each of the areas, which then causes you to get a subclinical response. Another thing that is a benefit of doing culture expanded stem cells here at our Cayman site is we do stem cell banking. And you think of that as just like a bank account, right? So when we draw out the stem cells from the bone marrow, it takes us roughly about a month to actually grow and culture those stem cells, like we mentioned. And then we freeze them or cryopreserve them for future use. And we have patients that have had cells in cryo banked and preserved for over 10 years. So you can come back and use your younger cells at a later time point. If you're healthier at this point in time, you have no injuries. We get athletes that do this all the time. And when they go and they're playing and their careers is progressive and they have an injury that pops up 2, 3, 4, 5 years down the line, they already have their cells banked and they can be used at a moment's notice. So cell banking is a very beneficial tool. I have my cells banked as well. So that way, when you need them, they're already there and ready to be utilized also. As we mentioned, Regenexx Cayman was founded in 2011, and we've been doing treatments since then, and we are the leaders in the field for stem cell therapy, particularly as it relates to orthopedics. And we've published a large amount of data with cellular therapy, culture, and non-culture stem cell therapy as well. And we've published safety data studies as well to show that these stem cell procedures are safe and there is no risk of increased cancer formation or following stem cell therapy. So what's the difference about Regenexx Cayman? And we've kind of touched on all of these, but just to highlight the high points here, the sheer number of stem cells that you're getting from a treatment is roughly about 100, typically more about 1,000 times more than doing a non-cultured stem cell therapy, which is what we do in the United States. So what that means is that we can treat more areas, but also from a dosing standpoint, which we know is important, is that we have more cells to adequately treat the pathology or the problem as well. So which goes to the next point. Obviously, you have more cells, so you can treat more areas, but then also when we have more cells, we can also save those cells that we don't need to use right now to use at a later time point with cell banking or cryopreservation as well. So here we have a couple of examples of before and after treatment with stem cell therapy and some PRP therapy as well, which I'll kind of highlight some of the results here. So here is a patient that we treated their lower back, the lumbar spine. And when we look at the lumbar spine, a couple of different things, but here's the bone, this squared block shaped item. And in between the bone is the disc, which is where this arrow is directly pointing to a disc herniation, right? And we can see that this disc is herniated and torn at both of these levels. And this is at L5S1 and this is at L405. And this patient here was a professional basketball player that was having severely limiting pain with radicular sciatica going down the left leg from this disc herniation. And we treated his lower back, and in 8 years, he has done great after, one round of treatment. And the interesting thing is that after the treatment, we got follow-up imaging to show that the disc herniation had resolved. And so, a thought process is that, well, did the disc herniation just get better on its own? Well, the interesting thing is that he had already had this disc herniation present for about 2 years before he even had treatment with us. So this disc herniation was stagnant, it was stable, it was not getting better. So the only thing that had changed for him was the actual treatment that we performed on him. And this was the after treatment effect, which was pretty impressive. This next image is actually of a patient that had shoulder treatment for a rotator cuff tear. So what we can see here for this shoulder, just to give you a little bit of basic on the anatomy here, this is the humerus right here. And the rotator cuff, one of the main tendons and muscles of the rotator cuff is the supraspinatus. It comes over and attaches to the side of the humerus here like a little bird's beak. And this arrow is pointing to this white defect in the tendon, which is a complete tear of this rotator cuff tendon. And we treated this patient, and then patient did great and had follow-up MRI. You can see there's no more white within that tendon or no more space. The tear is completely healed and resolved, and the patient did quite well. All right, so the next image here is actually of a hip injury. So this is a patient that we treated that had a tear in the labrum. So let me just give you a little bit of high yield anatomy here. So here is the ball of the hip joint, the hip being a ball and socket joint. This is your femur that connects to the pelvis, which is up here. And the labrum, which is this little triangle here, it sticks out like a plunger to grab a hold of the femur. And what we can see is that that labrum, that triangle has a little white dot in it right there, and that's a labral tear. And this patient had a precise injection where we take a needle and guide it directly into that tear. And we see that the tear healed and the patient did well. So, and I guess one of the most important things that we'll mention about this is the precision, right? Which is very important. This is very different type of treatment than traditional injections like steroid injections, where with a steroid injection, you can put it into a joint and all feels great for about 6 weeks. Then the pain comes back because it doesn't fix things, but it decreases the inflammation and it makes you feel better. With PRP and stem cell therapy, you have to be very precise, because if I put just stem cell therapy in this patient's joint, it's not going to heal this labral tear. We have to be very precise, use very high definition imaging like fluoroscopy or live x-ray and high definition ultrasound to help us to guide the needle in real time directly to where the injury is to get a good healing response to occur. All right, so here's a good example of looking at some of the major differences between Regenexx therapy, orthobiologic or biologic therapy versus surgery, right? So with the therapies that we do, they're all based in the clinic, which means that we're not in the hospital or a surgery center doing these treatments, which does a couple of things. It helps keep the cost down significantly. Every time you have a procedure in a surgery center, the facility fee is somewhere between $7,000 to $20,000 just for the facility fee itself. So it costs a lot of money to run a surgery center. The overhead is much higher. And the same thing goes for a hospital. Obviously, it's a big business, right? So in performing these procedures in a clinic, we're still able to have all of the amenities of a surgery center or a hospital procedure suite, but inside of the clinic is confined and it keeps the cost down. Again, these are needle-based procedures where we're not, slicing the skin open using scalpels, etc. They're very precise, but the tissue damage or trauma associated with the procedure is very minimal. Post-procedural pain is very manageable and tolerable. Typically, most people have some discomfort for about 3 to 7 days for about 95% of the procedures that we do, and then they're back to baseline and starting to notice some improvement over the next couple of weeks as well. Complications, which are not the fun part of doing any procedures, whether surgical or not, are very small. So most of the things we do have it under a 1% risk of complication, where the vast majority of complications that we see after these procedures is going to be post-procedure pain. Things like infection, tissue trauma, bleeding, nerve damage, paralysis, death, blood clots are extremely rare and much lower rates than our surgical counterparts and colleagues. Recovery, which goes back to the pain, the recovery is very truncated or shortened. So when we compare something, for example, knee replacement to a stem cell procedure for severe knee arthritis, it's about a 3-month recovery where most people are going to be out of work for about a month and a half to 3 months after a knee replacement. And that's if everything goes well. Or after a stem cell therapy procedure for advanced or severe knee arthritis, you may be out of work for about 3 to 7 days if you're doing a more manual or laborious job. But if you're doing more administrative or desk related work, you can be back to work really in about 1 to 2 days. And then the other good point here is what we're actually doing. So the goal of these treatments is to repair, regenerate, and decrease inflammation. Where with the surgical counterpart to that is usually cutting or removing damaged tissue, which changes the overall tissue dynamics and the biomechanics as well. So, we're not taking out tissue, we're trying to heal and stabilize damaged tissue as well and get an anti-inflammatory response to occur. All right, so let's talk briefly a little bit about umbilical cord versus bone marrow stem cells. So anybody that's in this space and considering one of these types of treatments, you probably are going to be looking at multiple different options for therapy, whether that be in Tijuana or Panama or here in our Cayman Island site, which is the best option. Obviously, I'm biased. But most of the other options or all the other options will be typically using allogeneic stem cells. And when we talk about stem cell therapy, there's two major groups. Allogeneic and autologous. Allogeneic meaning that these cells are coming from someone else's tissue, whether that be umbilical, bone marrow, fat, etc. When we talk about autologous stem cell therapy, that's coming from your own tissue, etc., from bone marrow, fat, etc. So, when we talk about everybody else that's doing stem cell therapy throughout the world, they're using umbilical or bone marrow allogeneic cells from somebody else. Why? Because it's easier to do that. It's faster, it's easier as well. The profit margin is much higher. Also, just to be very transparent with you, when we also look at the results of these types of treatments, the research has shown that when you take other people's cells and inject them into your body, they don't last as long because the body typically senses them as a foreign substance. And the outcomes are not as good when you use your own native stem cells. There's a good study that came out comparing stem cell therapy for knee arthritis, where they looked just at that variable, looking at patients that receive umbilical, fat, bone marrow stem cells from either from other people or from themselves, and then looked at the long-term outcomes at about 2 years out and who did better than others. And, in the results, the safety was better. And when you use your own cells, and the outcomes were better as well. So we know that, it's very convenient to use other people's cells. And sometimes we actually have to do that when patients have cancers or other health related issues where they can't use their own cells for a safety or outcome reason. Using umbilical cells from somebody else may be reasonable and they can be helpful and beneficial. But when we're comparing apples to apples, typically they're not as beneficial and definitely have more risk of complication when we compare them to your own stem cells, whether they be from bone marrow or fat tissue. Recovery and return to activity. So we have talked about this a little bit, but I'll make a couple of points here. So one of the most critical things after any procedure, or whether that be surgical or biologic procedure, is physical therapy. And why I say that is because you have the orthopedic issue that you have for a particular reason. whether that be you had a trauma, whether it's a car accident, a fall, sports-related injury, overuse injury from running, sitting too much, postural, etc. So your biomechanics are altered. When you have a chronic injury, it alters the way you move and the way you move your limbs in space, which then also functions and alters your biomechanics. And so if we don't address your biomechanics, you may do great for 3 years, 5 years, 7 years, but ultimately you will end up back where you were at some point because your biomechanics have not been changed. So we give you a structured biomechanical rehabilitation protocol to follow after we do these treatments because biomechanics is very critical to long-term treatment success. So we have to work on the biomechanics. We always strive to get people back active and returning to activity as soon as possible. So with that structured rehabilitation protocol, it tells you what you can and can't do for each phase of the recovery. There are some limitations with activity, typically for about the first 2 weeks, and then we start physical therapy, working on the biomechanics at about 2 weeks out. And then that progresses, and then we have a follow-up after that, typically about 8 to 10 weeks to check in on your progress. And then most people, after about 6 to 10 weeks out, are back to doing their sports and functional activities and noting significant improvements in their quality of life as well. Typically, at about 6 to 12 months, the improvement starts to plateau, and then people are just maintaining their improvements and having great outcomes for several years to come. It does not make you Superman or Superwoman. So I always tell people the worst thing that you can do is stop doing your biomechanical retraining once the pain is better, right? Everybody is guilty of out of sight, out of mind. So, oh, the back's feeling better, it doesn't hurt. So I stopped working out on my core. And guess what happens? The core gets weak and you develop a new disc herniation. So you still have to work on the biomechanics to make sure that we get the long-term success that we want you to get. So why patients choose Regenexx Cayman? I think we've talked about all of these high points, but I'll hit them as well. We deliver a very high dose of stem cell therapy and PRP therapy, which is very critical, as we talked about, from an outcome standpoint, because dose directly correlates with how well you do. Multiple joints we can treat at the same time. We treat multiple different types of severity of conditions, whether that be mild, moderate, severe arthritis, avascular necrosis, small partial ligament and tendon tears as well. We're able to bank your cells for future treatment, whether that be 1 year from now or 10 years from now. And we use your own stem cell therapy when we're talking about purely for orthopedic injuries. It's precise, image guided, where we don't do anything blind. All the research has shown when you're doing blind injections, about 64% of the time, you're not hitting your target or you're missing your target and the outcomes suffer because of that. It's not a steroid injection, so precision matters. And the treatment plans are tailored. When we have an initial consult with you, whether that be a virtual consult or an office consult, we sit down with you for about 30 minutes to an hour. We talk about your issue, we go over your imaging with you, show you the pictures, and then we come up with a tailored treatment plan just for you. It's not a one size fits all approach as well. And as I mentioned, we're very into research. We've published about 44% of the research on orthopedics to date. I have 2 publications submitted for publishing now. We're always publishing research to try and better the field, right? To figure out how can we figure out the nuances of who responds to these conditions and who don't, who does not, and how can we make that better? We're all board certified doctors that treat here that are all fellowship trained as well. So we have a high level of expertise. And the Cayman Islands, what's not to like about the Cayman Islands, right? It's very safe. The destination is beautiful, world-class resorts, restaurants as well. So it's a great place to have a treatment. There's no safety issues where you may have to deal with in some other areas that offer these types of treatments as well. We try to make sure that your treatment is a fantastic experience from start to finish. We have a concierge department that handles working with you, making sure your transportation is set up where we pick you up from the airport, bring you to and forth your appointments as well, and see you through this journey from start to finish, just to make sure we're able to get you better and doing the things you like to do. We have a video on YouTube. We'll send you that link, but this is just from a patient that we treated, Ryan Tannehill, professional NFL quarterback. We've treated a lot of professional athletes over the years, just giving his own personal testimony about how Regenexx changed his quality of life as well. And you can find that link on YouTube. We also talk about here just about the virtual consult, what it is, and it's a great experience for whether it be for yourself, family member, or friends, and it gives you the ease of doing something remotely, right? From your couch, from your home, with a family or friend. Sometimes we have today, for example, I had a husband, wife, and a son who are all physicians and dentists in multiple states, all on the consult together. So that way we can make sure that everybody was on the same page and to get their issues addressed and make sure they were heard and questions clarified and answered as well. So virtual consult or telehealth consult is a great option to make sure we can get in and accommodate you on our schedule and your schedule as well. And last but not least, we are running a summer special right now, and our patient care team can definitely give you more information about that. We're giving a discount up to about $1,000 off of treatment as well, or travel and airfare. So please don't hesitate to reach out. We have the contact information here on the screen with our clinic email for the patient care team and also our contact telephone number also. So what I will do now is I'm going to exit out of the PowerPoint. Again, here is the information for our clinic, the email, phone number, and our concierge international patients can reach our scheduling coordinators as well there. And we'll do some Q&A. We'll definitely get everybody a copy of this webinar via email, so that way you can share it with your family and friend if you would like to as well, or if you want to go back and revisit some of the topics, you can do that also. All right, here. Let me see if we can get some of the questions here. 1 second. All right, guys. So I don't have any questions in the Q&A chat here. If you have specific questions, you can put them in the Q&A. I did see a couple of people that had their hands raised also. So please let me know if you want to address a question live instead of putting it in the Q&A. I can do that right now and allow you to be unmuted. I think Mark, I believe, I'm going to unmute you as well here. So actually, I'm going to allow everybody to talk. So everybody can unmute if they have any particular questions also.
Can you hear me?
Hello, is this Mark?
Yes, can you hear me?
Yes, sir, I can hear you loud and clear. Good afternoon.
Would you put up that slide? I think it was the second one that showed all the doctors that are involved with this.
In that do Regenexx treatments in the US? Yes,
I think it was your second or third slide.
Let me see here. 1 second.
Thank you.
Not a problem. And this is probably not the fully up-to-date slide, but if you go to regenexx.com, you can get an update on all the different locations. All you have to do is put in your zip code and it'll show you everybody in the network.
The slide, the next slide, it was the one to the right. This is Regenexx physicians, that one. Thank you.
Yes, sir. Yes. And these are the physicians that come down here to the Cayman Island site.
Thank you.
Yes, sir. Absolutely not a problem. All right, guys, look like we do have some questions coming in. So let me go ahead and crank through those. So, all right, Dan, I see your question here. How do peptides compare to stem cells? That's a great question. So, Dan, when we talk about peptides, it's a very broad term. So a peptide can be anything from a smaller protein from an approved or unapproved medication. A common peptide that we probably have all heard of is lisinopril. Another one is antibiotic vancomycin, or even Mounjaro, right? Trizepatide, which is a popular peptide for weight loss. Well, people are talking about, particularly with peptide therapy like BPC 157 or tesamorelin, ipamorelin, and those types of peptides. None of those peptides, fortunately, are approved for clinical use, and they are not approved drugs in the United States. And unfortunately, with that being said, we have no clinical evidence that they actually work better than a placebo. Unfortunately, that may be changing as RFK does look to unregulate some of the peptide therapy, so research can be published on those. But right now, there's zero research published on those. So thank you for that question. All right, James. Question is, full thickness tear of the supraspinatus tendon, can this be handled successfully with stem cells? Great question, James. Yes and no. The no being that the magical limitation is the size of the tear. So if the tear is over 1.5 millimeters, 1.5 centimeters in length, then it's probably not a good candidate for these types of treatments and needs to be addressed surgically. The interesting thing that we found is that when you do have to do a surgical reattachment for a large rotator cuff tendon tear, the re-tear rate can be upwards of 70%. And the best way to get the re-tear rate down to about 0% is doing stem cell therapy at the attachment site into the bone as well. There's a good study that came out by a French orthopedic surgeon that looked at that, where he did treatments and post reattachment for rotator cuff surgery. He did one group where he put stem cells at the attachment site and they had 0% re-tear rate. So good question. All right, Miss Diana, what is the cost? So the cost varies on what we're actually treating. So whether that's be PRP can range anywhere from, depending on where you go at, from about $800 to $1,000, upwards of $6,000 or $7,000, depending on what structures are being treated, how many levels, intradiscal, non-intradiscal, bilateral knees, shoulders, etc. And then stem cell therapy, where we talk about cultured versus non-cultured stem cell therapy. Non-cultured stem cell therapy can range from anywhere from about $3,000 to $12,000, depending on what is being treated, how many different areas. And for cultured stem cell therapy, typically you're going to find a range somewhere of around about $20,000 to $30,000, depending on how many different things, where's the treatment being done at as well. But that really varies, and you have to have a specific treatment plan to kind of figure that out. But very good question. All right, Ms. Laura, can you explain the process for cells to be expanded? I see the second part of your question. Okay, very good. So culture expansion, yes, it's complex but simple. But on a most non-granular level, is that we take the bone marrow, and the bone marrow contains the different types of cells and products, and we take the mesenchymal stem cell out of that and put it into a flask, or essentially a petri dish, and put it in culture media that contains nutrients, including some of your platelet lysate, which is a type of PRP, and then we put that in an incubator and grow it until the cells fill up that petri dish, take a portion of those out, grow them again, and then we freeze them, and then we test them for sterility, we look at the viability, and we also look for toxins or infections as well. So that's kind of in simplest form. But if you look at some of our research papers, where if you go on our website, our most recent research paper, it has in there in the methods section the step-by-step process that we do for cell culture and expansion. Very good question. All right, Ms. Diana, if I have recently had melanoma cut out, can I do stem cell therapy? PRP or stem cell therapy? Yes, you can. I always recommend getting clearance from hematologist or oncologist for any of my cancer patients, but we have several patients that we have treated that have a history of cancer. Typically, we recommend about 2 years out if it's a solid tissue type of cancer or even a blood cancer, and always make sure our oncologist is on board supporting the type of treatment therapy and aware also. But yes, you can. And we've also had some people with active cancer that are doing PRP therapy to improve quality of life. But again, we always get the stamp of approval from their oncologist. All right, Ms. Laura, logistics for stem cell expansion from someone in the US coming to the Cayman Islands. Yeah, great question. So logistically, it's a two-step process where you fly down into the Cayman. It's a one-day trip where we actually draw out the bone marrow, do a bone marrow aspiration. That can be done with just local medicines such as lidocaine, but for people that have needle phobias, don't like needles, etc., we can do conscious sedation with our nursing staff, where you're kind of lightly asleep, or we have an anesthesiologist as well that we can do full sedation where you're completely sleeping for that procedure. It's a very easy procedure, takes roughly about 30 minutes to do. There's really no recovery. The only limitation is that you can't do any submersion in water for about 72 hours just to prevent any infection risk with that. But there's really no pain for the recovery process. And that's a 1 day process. And it takes us, as I mentioned, about 4 weeks to grow the cells and culture. And then at that point, after the 4 week period, you can then return to have the stem cell therapy. It doesn't have to be at 4 weeks, but that's the soonest that you can come back after we've grown them and put them in cryopreservation. It can be 4 weeks, or it can be 4 months later or 4 years later, depending on your needs as well. But great question. And when you come back, we do the treatment really separated out over about 3 to 5 days, depending on how many different areas we're treating. We typically do a couple of different other things to help to optimize the improvement in outcomes, such as infusion therapy with vitamins, minerals, NAD therapy, etc., laser therapy or shockwave therapy as well. So it's really patient specific, depending on what we're treating, kind of what the treatment protocol is over that 3 to 5 days. But great question. Let me see here. I have a question in the chat. Nope, that's Lauren just giving us some updated information to Mark. Well, guys, I do not see any other questions in the Q&A. I'm happy to answer any additional questions, thoughts, concerns, pressing issues that you may have on your mind as well. But if not, then we will make sure you get a copy of this for your records as well to share with your family or friends or to reference back for going over the information again at your leisure. And please do not hesitate to reach out to us and contact us. I'm more than happy to answer any specific questions. If you want to shoot me an email also or set up a consult, we love to chat with you as well. It's been a pleasure. Thank you so much for your time this afternoon, and please be safe and have a great day.